I'm Robin Coleman for Group 16, interviewing Jerry Cucarillo. Hey Jerry, how are you today?
I'm great. How about yourself, Robin?
Good. We're doing a project about the perspective of nursing in the culture, and we were just curious, have you had any um, interactions with nurses relatively recently or frequently?
I do have frequent um, interaction with nurses, frequent and throughout many years.
Have you had to stay in a long-term care facility, like in a hospital with maybe a surgery or something, and had a nurse take care of you?
Thankfully, no, I have not.
Okay. How would you say that nurses are viewed in society?
I'd say nurses are viewed kind of like a caretaker. They're they're there to assist people in their time of need, whether they're there for a minor operation or sickness, or something long term, something major in their life where somebody can barely move. And it's pretty much they're there as a caregiver and helping out these people.
Okay, would you say that nurses are usually seen as subordinates to doctors?
I would say yes. You know, doctors do go to school for a longer period of time, and they do have that longer period of education and practicals and the training. So I would have to say yes to that.
Okay, would you feel comfortable being taken care of by a nurse, like as a primary care?
I would feel comfortable. I do feel they are very knowledgeable and they do a lot of the legwork when I do have interaction with them.
Okay, who would you say out of the doctors and nurse, who probably does most of the work, I guess, and who tends to the patient a little bit more?
I'd say the nurses normally do. Normally, when I have interaction in a doctor's office, they're dealing with me up front from the beginning, doing the basic tests from the beginning and finding out what's wrong and why I'm there, and to be able to give all that information to the doctor. So I definitely do see that more, you know, in the beginning and also at the end, helping me with any additional questions I may have or paperwork or things along those natures. So they definitely do a lot more, um, actually personal interaction than the doctors do.
Okay, what kind of nurses can you think of? Like job opportunities for nurses, if you will.
You know, to me, when I think of nurses, the biggest part is the hospitals. That's where you normally see the largest amount of nurses. You also see them in doctors' offices, of course, as we discussed, and also in schools.
Okay. All right, I think that about sums it up, but thank you for your time.